I'm Dr. James Amos, and I'm the consulting psychiatrist at the University of Iowa Hospitals and Clinics. And we're going to go through a quick delirium assessment demonstration in which I'll demonstrate the use of the confusion assessment method and the Mini-Cog, and we'll have a look at our institution's delirium order set as well. So just as a reminder, the confusion assessment method was developed by Dr. Sharon Inouye and others, and it involves essentially four elements. You have to have an acute change in mental status and a problem with shifting, focusing, or sustaining attention. And generally the mental status fluctuates as well. In addition to those two, you have to have either a fluctuating level of consciousness or cognitive disorganization. Now, it's important to remember that at our institution you do have access to the delirium order set, and we're going to take a quick look at that. After that, we'll go through the Mini-Cog, which is a way to enhance the sensitivity of the confusion assessment method, or the CAM. So let's move to a consideration of our delirium order set. The delirium order set is projected on a laptop screen, and so the screen may flicker quite a bit, so I'll go through it relatively quickly. It's an Epic health record delirium order set that we put together here, and as I roll through it, you can see that it includes some laboratory evaluations and some suggestions for disease-specific workup. Some labs you see there that are suggested, non-pharmacologic measures to manage delirium, mostly from a nursing standpoint, and geared toward improving or increasing mobility and extrication from restraints. Behavioral management continues here in this location, and most of all, ensuring patient safety measures are on this view. And continuing our suggestions for medications, both those to avoid and dosing recommendations on those to use for behavioral management. A preferred medication list is on this view. If patients need psychotropic agents for any other reason, it's always important to remember that in the setting of delirium, any other psychiatric condition is virtually almost impossible to confidently diagnose. And so it may be best to consider not using any other psychiatric medications or starting any new psychiatric medications, and using those that interact the least with any other medications, as shown here. Managing other problems such as constipation and pain, medication adjuvants, also listed here. Preferred medications for the management of other symptoms are listed here. And that does it for this. So now let's turn to the Mini-Cog, and this is a very simple bedside test that almost any health professional can do, and it takes only 2.5 minutes or so, and it involves getting their orientation, asking them to repeat 3 items, and asking them to recall those later after you interpolate a clock drawing task. Usually that involves asking them to put all the numbers on a clock face of a circle that you draw, just to ensure that it'll be big enough for you to see, and then have them make the hands of the clock show the time 10 past 11. Following that, you ask for the 3 items that you asked them to recall, and that's it. That's the Mini-Cog. Let's go through a couple of examples. Draw a clock. Nobody's ever asked me that before. You serious? Draw a clock? Yeah, okay. Okay. You serious? Draw a clock? Okay. What time is it? 10 past 11? Doesn't matter what kind of clock this is, Radio Shack or what? Doesn't matter? Okay, dude. Okay, so that's it. That's how you diagnose delirium. I know you can do it.